Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Sonal Mirotra Kapoor. Those were the headlines at this hour. But let's begin the show by bringing you the latest on the COVID figures. The past 24 hours has thrown about 70,400 more cases in our tally, which is good news. Why? Because at the moment, our positivity rate remains to be below 5% for the 7th straight day. More crucially, the R factor, remember? The reproductive rate tells you the intensity at which the virus is multiplying. That also has come back to its safe limit, which is below 1. To be precise, it's 0.74 at this point, which is also the lowest since the 15th of May. Now, as we look at those numbers, let's shift to the discussion of the show today. And today we are bringing you a new study. A study which says that if you've had COVID earlier, only one dose of vaccine should give you enough immunity. Now, the study conducted by the International Journal of Infectious Diseases says that single-dose vaccination in previously exposed cases is an efficient strategy moving forward so that we can bring more and more people under the vaccine cover. Study compared basically previously infected people with never infected people and tried to see the effectiveness and perhaps how much of an antibody cover they were giving to the people, and then they concluded that one dose should be enough. But so many questions really come to mind when you think of a study like that. So let's cut across live now to Dr. Nageshwar Reddy joining us. He's the chairperson of the Asian Institute of Gastroenterology in Hyderabad. Thank you so much for your time, Dr. Reddy. Very interesting details coming out in the study. But I have to start by asking you this, the first question that really comes to mind here is that not everybody will have the same amount of antibody cover post their infection, right? We've seen some people develop very good antibodies, some none at all. So how do you factor that when you say and conclude in a study that only one dose to those infected and thus significantly with antibodies is good to go for now?
Thank you. Thank you, Sonal, for having me on the show. When we actually conceived this study, we thought it was important to utilize our vaccine resources very intelligently. And so therefore, what we did was we took patients in actually hospital employees who had COVID about 3 to 6 months before and compared with them those who didn't have. You raised a very important question regarding the antibodies. You're absolutely right. It's very difficult to correlate the antibody levels with protectiveness and so on. There's a lot of debate in the literature on that. But what we did was when we actually looked at the antibody levels in those who had COVID long back, say 3 to 6 months back, the antibody levels were very low actually, not very high. And we specifically looked at neutralizing antibodies against S1, S2 spike proteins. But when we then gave them a shot of single dose of vaccine, the antibody levels went up to 1,000 units, which was 10 times more than what would happen in a normal person who didn't have a COVID. So we actually had a comparative group of those who didn't have COVID, and their antibody levels went up to 100, whereas those who had COVID earlier, their antibody level went up to 1,000. But as you rightly said, does this mean that antibodies will definitely protect against this infection? So we went further actually. What we did was we looked at the T cell memory cells. Now we know that antibodies at a certain level can be helpful, protective, but we're not always sure. What is more important is the so-called T effector cells. Our body has these memory cells which actually memorizes any virus or any foreign body that comes into our body. These memory cells go back into the bone marrow and wait there, and whenever there's a new infection, they immediately come out and then they actually make the B cells produce large amount of antibodies. So this is a more effective mechanism of protection and long last. So we looked at two types of T cells, T effector cells, CD4 and CD8. And what we found was both these CD4 and CD8 were markedly increased in those who already had an infection and took one dose of vaccine. Now this means that CD4 is medium term and CD8 is long term protection. This means that those who take a single dose seem to be protected for at least 12 months against this infection because of such high levels of memory cells. So
12
memory
months, you say?
More important.
Okay.
Yeah.
Okay. Can I also ask you which vaccine have you tried this on? I'm assuming this is all on your staff, so it has to be an India vaccine?
Yeah, so what we used in our staff was predominantly Covishield because that was a vaccine that was given to healthcare workers in the first injections that were done.
Right.
This was in January to February the study was done. But I believe that this could be reproduced with all the vaccines. In fact, we are now going forward with a study where we are trying all the 3 vaccines, Covishield, Covaxin, and Sputnik in the same way to see if 1 dose is sufficient, because then you save at least 1 dose, and this also actually
for
goes
the rest
in with
of the
government
population.
policy.
I understand that. Also, the issue of antibodies is very interesting, very fascinating, and there is still so much more we need to know about, these antibodies and COVID antibodies. But we have seen sufficient data now which suggests that your natural antibodies also sort of wean off in some time. You see that even if you get an antibody test done, you see that every 3 months the number keeps coming down. So in that case, how is one supposed to see this study? Are you suggesting that only 1 dose is enough for now and a booster dose should be taken later? Or are you saying no booster dose required at all?
So again, some interesting points, Sonal. What happens to natural antibody levels is over a period of time, 3 months, 6 months, they start coming down. Now, just because antibodies come down doesn't mean that you're not immune against the virus. There are other factors also. Most important is the memory T cells. Now, what our study suggests is that taking 1 vaccine immediately boosts up the antibodies so that your protection is specifically neutralizing antibodies. This is important to emphasize, not general antibodies, neutralizing antibodies. And because T effector cells, memory cells are also completely now memorizing this virus, it will be effective. My belief is a single dose will protect for about 12 months. And then we don't know what happens. We don't know long term now. We are just continuing the study. And after 12 months, maybe you have to take a booster. So at least you don't have to take it immediately.
All right. Dr. Reddy, thank you so much for your time. It is a peer-reviewed, studied, and lots of fascinating details to unpack from that. Good luck in your future endeavors as well. Let's take it forward with our panel now. Very delighted to have Dr. Shahid Jamil back with us on the program. We have Dr. Pandya joining us and also Dr. Shenoy on the program. Dr. Shahid Jamil, the issue of antibody is really the thing everybody wants to know now. But can I just firstly address another concern that I had about this study? We just had Dr. Fauci speak with NDTV not very long ago, and he did underline this very clearly, that the gap increase between the 2 doses can lead to this struggle and this entire issue of new variants coming in. How do you see this study vis-a-vis the threat of a new variant, etc., in the India context, that is?
Well, it's very clear, Sonal, that single dose will only give very limited protection. And if your protection is not good enough, then suboptimal levels of antibodies are going to actually select for variants that will evade antibodies. Right. Think of it like an antibiotic that you take. If the doctor prescribes you antibiotics for, let's say, 5 days, and you take it for 2 days and you start feeling all right and give it up, then you are at the risk of developing antibiotic-resistant bacteria, which are then even harder to kill. It's the same thing here. Mutations are random, but the selection of those mutations is based on some selection pressure. If you give good levels of antibodies, if you have good levels of antibodies, it will destroy the virus. But if you have very low levels of antibodies, then some mutants may escape, and those mutants become antibody escape mutants. So certainly, I think we need to make sure that the protection from 2 doses is given as quickly as possible. And when I say as quickly as possible, of course, based on trial, the clinical trial, and based on the evidence that is available. And so far as I can see, the evidence is only up to 12 weeks. I don't know where the 16 weeks came from. And if you see what Public Health England has done, if, since the Delta variant is spreading very quickly in that country, for people who are more vulnerable, like people above 60, they have reduced the duration to 8 weeks. That's the right thing to do.
Right.
You have to have a nuanced approach based on the data available, based on the evidence available.
All right. So you're saying take it with a pinch of salt at this point, be a little careful about this. Let me bring in Dr. Shenoy in the discussion as well. Dr. Shenoy, just people who are looking at this study right now, could you simply break down for us when it comes to the different antibodies? And let me put out 3 examples for you. The ones which are naturally procured when you get the virus or when you contract the disease, versus the ones induced by vaccines, versus your T and B memory cells. If you could just sort of chalk out a simply put analysis for us on which is the strongest, which lasts longer and gives you good protection.
See, whenever you get an immune stimulus, immunology is very complex. Let us be very this thing about it. When we simplify, we'll be misquoting a lot of stuff, but still I try to make it as simple as possible.
Please.
Whenever you get an immune stimulus, be it a vaccine, be it an infection, you get stimulation of T cells and B cells. The B cells produce antibodies, and T cells results into T cell immunity in the form of CD4 and CD8. So even if after some time what happens, even if the stimulus goes off, for example, you had an infection, after 1 month, the T cell, within 2 weeks, the antibodies and the T cells will get activated. At the 1 month, it will peak. And after that, slowly the antibody levels will come down, but the body will have the memory of whatever has happened.
Got that.
Whenever,
okay.
So whenever you get the next time the infection, the T cells and B cells will pick up. So there is a memory component there. But at measuring the immune response at 1 month gives you an estimate how much immune response has been generated. For example, if you have an antibody of 1000, it's more likely that whenever you get the next time the small stimulus comes to you, totally the immune system will reboost and fight the virus.
Right.
So let us take whatever Dr. Reddy told some time back. We are also observing the same thing in our center when we are doing some antibody analysis and T cell analysis. What we are seeing is those who have had infection, even if after getting the single dose, their antibody levels are quite high, which is comparable to 2 doses of the vaccine. Why is it so? The first stimulus is the virus, and second stimulus acts the vaccine. Second stimulus acts as a booster. So the first infection acts as the first dose, and the virus, the second vaccine acts as the booster dose. So
I understand that.
I
understand that, but I think what Dr. Jamil is also trying to say is that that's not a can I just simplify it, oversimplify it, say that it's not a dependable immunity here, and we really need the booster dose as well. That's his point over here. Let me bring in Dr. Sapan Pandya. Your thoughts, Doctor?
Yeah, I sort of, you see, it all depends on who the host is, as both of them have said. The best case scenario is, as Dr. Shenoy said, you have an infection and then you take the first dose of the vaccine. Those are absolutely the highest level of antibodies that you ever get. So those and then it depends on the host factors. Like if the patient is an old age, say above 60 or above 65, or the patient is immunosuppressed in some way in the form of receiving immunosuppressants, or suffering from autoimmune diseases who are on immunosuppressants, or there are those with comorbidities. Now they might wane their antibody levels earlier than the others who are much younger and who have a good immune response. So in those particular hosts, as has been recommended, you might need the booster certainly earlier, at least 8 to 12 weeks, what the current recommendations are. Than in those who give a very good response, and especially young patients, those who don't have any other factor, and they are infected, and then they receive 1 dose of vaccine. I think they can have B cell and T cell responses for a long time, and they might not need boosters.
Till the time we have new variants. I think that's also to be noted over here. I wish I had more time, gentlemen, to discuss this. Such an interesting and fascinating subject of antibodies, really, but we'll return to that later on the program. Thanks so much for joining us. All right, we're going to slip into a very quick break. On the other side, we'll bring you a special segment, Vaccinate India. Welcome back now to our special campaign, Vaccinate India, in partnership with Google, where we're discussing some of the questions you often Google and have experts answer them for you. Dr. Sapan Pandya is with us. Thanks, Doc, for your time. The first question that people often Google is actually regarding the effectiveness of the vaccine. And a lot of people often confuse efficacy with effectiveness. Also, we just discussed a study a little while ago where we talked about, is it really working along with the natural antibodies? Your thoughts on people trying to understand how effective these vaccines really are?
See, thanks. So the first thing that people need to know is what is important for us is mortality or hospitalization after these vaccines. Now, if you look at that, then the hospitalization rates and deaths are almost less than 5%. And you take any vaccine, and mostly the vaccines are very efficacious that way.
Right.
When it comes to efficacy, which is probably the second most important thing for people, it is the number of cases which actually come up even after taking the vaccine, the real life data of the clinical situation. And there again, the efficacy of these vaccines are mostly in the range of 70-75%, even after one dose. After two doses, it increases even higher. It will also depend on, as I said, whether it's an older population that you're looking at, then it's slightly lower, that kind of a thing. Now, effectiveness is actually, what one has to prove when you make these vaccines in the laboratory, and the immunogenicity, which is the response in the lab and the antibodies that these patients make. So efficacy is different from effectiveness in the sense efficacy is real life clinical data of what number of cases are coming up even after taking the vaccine. So for our patients and for our people, the most important things are, number one, mortality and hospitalization, which is close to less than 5% or zero in most of these vaccines. So even if you get the disease, you're not going to get it severe. Number two is efficacy, which is the number of cases which you might still get that COVID infection after the vaccine, which is also not very high, about 10, 15%, 20%. And the last is effectiveness, which is, of course, immunogenicities are very good. The lab values about 85 to 95% in the lab, which is something that is more for the manufacturers of the vaccine than the scientists.
All right. Let me bring on the second question then. Since we're talking about vaccine effectiveness, what about vaccine side effects as well? And I also know a lot of people sort of Google about it, and the only vaccine hesitancy that we see in the country is regarding these side effects actually. So what can we tell our viewers in order to tell them that vaccine hesitancy really needs to be dealt with, and side effects, if any at all, will actually wave off in a day or two?
Yeah, so the side effects, as we always tell our patients, this is true regarding the medicines also that we use, is like driving a car, and you can meet with an accident when you drive a car. But as long as you go by the traffic rules, by the red lights, you won't really meet with an accident. So while I will say that, yes, it's possible that some of them might get side effects, but the chances of side effects, the proportion of patients who get side effects is, especially the serious side effects, is so low. If you look at the advantage that the vaccine offers, so the benefit risk ratio easily goes in favor of the vaccine. So I think without thinking much, there are some tests that obviously, some questions that we asked as vaccinators to the vaccinees. And so based on that, we make a judgment if really these patients can have a problem. And after that, if your doctor recommends, or if then you should go for the vaccine. I think unless and otherwise proved, all of us should take the vaccine and not worry about the side effects. Right. That's the bottom line.
Very quickly, I'm running out of time, but I wanted to understand, is it true that older people get less side effects and younger people with stronger immunity have more side effects?
They can get slightly more side effects than the older people because of the waning of the immune system in the old, yes. But not much, generally. The proportion is very less.
All right. Good to have that sorted out. Thank you so much, Dr. Pandya, for your time. That's all we have on the program today. See you again tomorrow. Bye-bye.